I first started working with Steve Jobs and Bill Gates when they were 27 years old. And they both had the same vision. And the vision was to change the world one person at a time with computers. And at those days, the early years of the personal computer industry, most people had never even heard of a personal computer. So the idea of owning your own computer was a pretty interesting concept for people to understand. Two really bright leaders who changed the world, but two very different ways in which they thought about it. Steve Jobs thought about it in terms of how do I give somebody a bicycle for the mind? It was all about the experience. And with Bill Gates, it was all about change the world one person at a time and do it with a land grab. And you could make adjustments in time with the products, where Steve said it had to be perfect the first time. Now, what stood out to me with both of these individuals, because they were clearly geniuses and great leaders of the industry, and they shaped the principles that we see today, 30 years later. But what was interesting to me was how they thought about things. And it's pretty clear to me as Jill introduces the topic, which our keynoter is going to talk about today, that the idea of gaming and social health is not something that someone in my generation can add value to. Just as Bill Gates and Steve Jobs could think about things differently when they helped create the personal computer industry, it's going to take a new generation of leadership to think about how do you start to engage the patient, the consumer, in the health experience. The other thing that impressed me about both Steve and Bill was their ability to motivate other people who want to join their team, and they were both incredibly talented recruiters. They could recruit great talent. Microsoft had great talent, Apple had great talent. I met Grant Verstandig about a year ago, and he's 23 years old. He dropped out of Brown University, but that's okay, because Steve Jobs dropped out of college, and so did Bill Gates. He didn't drop out because he was having a problem at college. He dropped out because he wanted to get on with changing the world, and he had some big ideas. It's unusual to see someone 23 years old leading a company, and in this case, leading some of the principles that I think are going to shape the future of healthcare. But he's also been able to recruit an incredibly talented team around him. And it's the quality of people that you can attract to help you bring a vision to reality that makes a difference. It's a real pleasure for me to introduce someone who started out as a partner in business. We ended up becoming really great friends, and I enjoy being his mentor. I have no day job with Audax. I'm there kind of as a resource when he wants to call on me. But Grant Verstandig, I think, is going to give you a very interesting insight into terms of how does he think about gaming and consumer engagement in the context of healthcare. Grant.
Thank you, John. So it's a good thing in some sense he doesn't have a day job, because then I wouldn't have anything else to do or anyone else to call on. But when we talk about gaming, we talk about social, there are these very interesting ideas that for a lot of people in healthcare are just ideas or even buzzwords to talk about. But when we think about the actual business of healthcare and why everyone here is in this room, it continues to grow at such a staggering percentage that at some level it simply cannot sustain. For me, I had 7 knee surgeries in 20 months and watched this firsthand financially, emotionally, physically, and yet we still have this interesting bucket of 75% of every dollar we spend goes to the treatment of something preventable. 75%. And if we think about how those 75% can get connected, I would ask here today, how many of you in this room are connected in some way to one of those buckets? Whether you're a representative of the business, you're part of the business, you're the guy in the middle with his hands up in the air, we all have something in health. Everyone has a health story. But there's all these complicated systems. There's a hospital system. A lot of people don't even know what a PBM is. There's these insurance organizations. There's an employer who also pays my benefits. These organizations. And one of the things that was interesting about John, and when John talked about technology, talked about Apple, and I see iPads and all these other things today, it's about simplicity. Yet we have the most complicated ecosystem in the entire world when it comes to healthcare. So what is the big idea? The big idea is putting health in the hands of the individual. And I wouldn't be standing here today to even talk about this had it not been for some interesting breakthroughs in technology that I'll talk about in a little bit, but also coupled with the financial ramifications of where we are today. It's time to put health in the hands of the individual. Time for me to be not only accountable for my own care, but also understand how my care affects those around me. Our baby boomer generation gets older and older, and they're caring for people that are their parents, but also their children. And so now the ramifications of every single individual decision gets compounded. And so when we think about healthcare, the real aha moment should shock nobody. It's let's put health in the hands of the individual, and then let's take all of these organizations, from hospitals to PBMs to insurance organizations to the employer, and let's put them as assets around this individual, and let's let the individual connect and engage so that they can get better, so that 75% can start to change, and we can be empowered to make decisions that fundamentally affect the entire ecosystem of healthcare. And when we think about the ecosystem, every decision that we make that affects those different buckets around us, now I know how to switch to a brand, from a brand to a generic. Now I know how to get home delivery. There's all these values that not only drive me to get to better behavior, but a fundamental shift in the quality of the entire system. So now I'm getting healthy. The system that's almost bankrupting our entire country is going to turn, and we're going to look at a population where all the decisions that we start to make affect our day-to-day basis, and you might be able to say, I feel pretty good today. I took my medications. I feel good. I lost the 10 pounds. I was able to get over the ADD. I was able to take the medication and to overcome any of these issues we might have had before. And I wouldn't be able to stand here in front of you today if it weren't been for 4 major breakthroughs that have happened over the last several years that get to why we're talking. And the last several decades have built up, starting with Google, then getting into search, and then social, getting into Facebook, Google+, Twitter, getting into mobile, give me what I want, when I want it, where I want it, take pictures with your iPhone, and then gaming, being able to engage in something that's fun, but I just want to do it because my friends are doing it. That's something that people say today, all the time, but we've never thought about how that could affect healthcare. And if you look at this slide, the numbers on the top is to represent that internet is actually ubiquitous, and we all get that, I think, is that internet is everywhere, across incomes, across demographics, yet the percentages at the top are much, much larger than the percentages at the bottom. So we're still using all of these devices. We're using the web, whether it's the phone, whether we're searching, whether we're using Facebook, but yet we're searching for all this information and then not getting what we're looking for. Yes, there's WebMD out there, there's all these great content places, there's all these provider networks, but there's not one place. And so the first breakthrough is taking that one place idea and applying search and recommendations. So Netflix. Netflix says, I bought the movie The Town. It's got Ben Affleck in it. Let's call it a keyword. Wouldn't you like to see another Ben Affleck movie? Sure. And it's actually building something for me based off of my interests. Well, this complicated system of healthcare, wouldn't it be nice if all of the things that were brought to my front door were for me? When I had my knee surgery and I went to WebMD, they said, you must have osteoarthritis. Nope, I'm actually 22 and don't have osteoarthritis. Oh, well, what about this content? No, that's not it either. So taking recommendations so that data can come find me. Let's bring health to the individual is the first breakthrough. The second is Facebook. We've now created, with Facebook, with Google+, with Twitter, a web of people and a web of places. And we say things like, my friends are doing it. how many people liked it. And it's actually driven an engagement and a quality of what we want to do with our lives based off of our friends, which makes complete sense, but that's now on the web. We're now 4.7 degrees of separation from any other human being in the United States and then to the world through Facebook. So this graph shows how powerful social networking is to connect not only to our friends and who I went to Brown with or who I played the sports with, but then to John Sculley, to Jill. And then, but if you think about social networking as it's so ubiquitous, there's 1 billion users almost on Facebook. And 85% of companies have a social media strategy. But again, the second statistic about healthcare cut it in half. So we're just behind. We'll just ignore it. Social will happen later. Let's wait another 10 years. We'll see what happens. We can't. So when we think about the latter and timing, there's also been an interesting advent of 500 million users connecting online, socially through Facebook to play games. We have Farmville, Frontierville, Cityville. There's EA games, Disney games. And all it is it's about connecting people in a fun, positive experience. But what they've built is not a virtual farm. They've built something that you're investing your time, your energy, your network, because now you have to get your friends to get to the next level. You have to get another friend to get to the next color tractor. But we've invested not only 500 million users, but there are now publicly traded companies that have built entire business models off of the same psychology and the same behavior of connecting a web of people and places around something fun and exciting. And then the last is mobile. And this is basically what I like to say is give me what I want when I want it. And most people with iPhones, with iPads, the world happens with you now. It happens in your pocket. And this one interesting correlator is this world always happens with technology. It's always here. But yet with healthcare, which is also always here, we go to portals still. Until recently, we still called our doctor or our nurse to create a schedule. We'd say, hey, are you available tomorrow? And then you see things like ZocDoc allow us to connect online and create a real-time engagement for getting in to see my doctor. So we have this app network, we have this mobile internet, we have all these things. Yet for healthcare, we've basically ignored it. We've said, check your pills. We've never said, check into a challenge with your friends. We've never said, what about this decision I'm about to make? Oh, okay, I get it. I should switch to this generic. What about the timing of this? That's what mobile really comes in. It's about timing. It's about giving people what they want when they want it. So now we have this idea of I'm in the middle, and then I have these 4 fundamental things around me that we're always using, we're always engaging with. And now why don't we turn that on ourselves to say health is always with us, and we can make a difference with our friends. We can make a difference because content is now finding me and is personalized to me. We're enjoying the experience because we're enjoying the value we're getting back. And then we can search for content that's specific to things that might change, life events that might change. And all of this is moving around us. And so where the future of healthcare is going, it's actually already here, and it's starting. Facebook and some of these other companies, Facebook, Google, Apple, there's one destination. And one of the things that's missing in healthcare is there's 50, 100, 500 destinations. And none of them are really an aggregate. None of them give you the engagement, the connectivity of Facebook, the retention and the enjoyment of the Zynga game, or the recommendation engine of Amazon. Hey, you bought a Samsung computer. You might like a Samsung monitor. Hey, you take this medication. Do you want to be reminded for it? Hey, did you know that your other 2 friends who you're in this challenge with also bought this product for running that 5K marathon? I did. So bringing health to me. And one of the things that's really powerful about social is inherently it's one-to-many, many-to-one. So if we take an example of what is one-to-many, many-to-one, there's all this data. And that's represented at the bottom of this slide. Lab data, data you put in online, claims data. We have all this data. But then there's me. And now I, in this new wave of healthcare, can connect with other people that are 22 that have had 7 knee surgeries. I can connect with other people who are physical therapists and expert resources and ask questions. I can connect with a doctor. And I can do it all in one place. We can do it all in one place on Amazon, on Facebook, but not in healthcare. And so when people say, and we ask this, is healthcare being revolutionized by gaming and by social? The answer is yes, because there's all these exciting opportunities out there today. And if you think about I'm a user, and I'm 22. I want to train for a marathon. Why don't we take content like Groupon's, Living Social, and say, hey, did you know there's a running class where you can learn how to build the actual structure and sprint technique to be an effective marathon runner? Did you know you could ask these 50 other people, you can connect with them about this marathon? And is training too much? Is 4 times a week too much? That's actually not 5 times. Okay. Well, where do I store all this information? How does my accelerometer, my Fitbit, show me what I'm doing over time, how many miles I'm running, but then I always feel so sore the next day. Am I drinking enough water? Oh, it's all stored in this one place. And it's not just one silo of water, of accelerometer. But then, on top of it, what have we learned from Zynga and social gaming is that there can be a weight to that engagement. And what Zynga and social gaming and EA and Disney, what they've really done is they've said, there's these things called coins or chips. We play with them in Vegas all the time. We have a weight to them. There's a value. Why can't we assign for every time you come back, for every time you click, the same positive reinforcements that say, oh, you're back, you won. You won this color coin or that color coin. And you can show your friends how many coins you've actually won. And now you've taken this thing called healthcare. You've taken an engagement and you've put a currency to it. You've put a value to it that makes me want to come back. And it's not about money. It's about the experience. Same reason why we play Farmville. I'm building a virtual farm and a pink tractor. But it's because I've come back to do something fun and I'm rewarded for it. One of the things we're missing in healthcare is there's this feedback loop. It's broken. If I drink a Coke versus a Diet Coke, nobody tells me any difference. But if I drink Coke for 40 years, that sugar will have an effect. So why can't we go backwards and say, every time you come, let's get positive reinforcement. Oh, you had soda. Okay, well, at least you came back. Did you know that the sugar is actually really bad for you? Nope, don't care. But you came back again and again. And every time you come back, we hit you with that progression that you're still actually making progress because it's on your mind, because you're here. And then you can start to, over time, build that psychology into changing behavior, getting to that Diet Coke. So speaking of Coke, and speaking of diet drinks, let's think about Jim, who's a 45-year-old man with diabetes. And we've got Facebook, but I don't want to go out and say on Facebook that I have diabetes. I want to go find people who are also 45 years old and say, what is it like having diabetes at 45? Well, tell me about taking blood. That seems scary. I'm actually kind of afraid of needles. What are the medications? Does it really cost that much? Should I be worried? Should my kids be worried? I want to ask all those questions to other people like me. I want to ask my doctor those questions. Now something has changed in my life where I was not a diabetic. Yesterday I wasn't aware of it, but today I am. The content should be different. I should have people tell me. I should have now Groupons. I should have Living Social. I should have the WebMD content about what it's like being diagnosed with diabetes. What are some of the other things you should think about? Should I exercise more often? Why? And so now I've got this content, I've got the connectivity, and then I'm allowed to take that and I'm allowed to share it and build an engagement that is with me everywhere and say things like, I want to set a text message reminder for when I need to take my blood glucose. I want my blood glucose to be in a system that I can compare my blood glucose to my Fitbit. Why is that so revolutionary? And then the last thing to think about for us in a business case and about how social and gaming are changing healthcare, it comes down to quality. And it comes down to quality because think about Jim, and think about Jim coming into this system. And he's now learned about a tutorial video was pushed to him, intelligently saying, we understand that you said by this question, by the content you look, that you're afraid of needles. Here's how you should self-inject. Here's how you can take your blood. And then now, the payers in the room who get to see a lot about their patients when they get the bill. They get to see a lot about their patients with claims that 1% of the time get to view into the other 99%. And they can say, oh, Jim's actually afraid of needles. That's why he's not compliant. Let's stop sending reminders about the problems of not taking your medication and correct the original behavior, which is he's afraid. So someone send him a tutorial. Or let's build a support system and say, now we can couple claims data with the questions he's asking a community, with my blood glucose data, and do it in a safe and secure environment to get to avoiding the hospital visit, that ER visit. And then thinking about how we can take people out of the hospital because we can avoid that care. We can avoid having to see the doctor. And we can connect with each other and then say, you know what, we have all this data about the Fitbit, the blood glucose, and then the fears, and we can save money in our system. And Jim can be healthy. Yet when we think about the business, the numbers are there again. 90% of people in the payer market have thought about this type of change. The numbers are still there. We need to make the change. And the last thing to think about is there's 7 paths, there's 7 messages to take away that really need to define this new social health space. The first is it's got to be simple. The reason why we love some of the products that we love with Facebook, with Google search, it's simple, it's easy. All these things about the average registration for an online healthcare site is 17 fields. The average registration for Facebook, 2. The average registration for Google Plus, if you have a Gmail account, put in your password, 1. The second is social. This idea of connecting with other people that are like me. I don't want to be alone. So I can actually go out and connect with people about what it's like being 45 and having diabetes for the first time. We have an example. What if I just got diagnosed, or I just heard about this thing called autism, and I want to ask the hard question: when should I be worried about my son? When should I reach out to a physician? Should I believe in this evidence-based medicine or this best practice? What did you do? How did you do it? And get the information so that every day counts for diagnosing an illness, for building up a young kid's ability to create and to learn and to adapt. Make it interactive. That's about micro-behavioral changes. You're never going to get somebody to drink Head Coke every day for 40 minutes to just say, you're right, high fructose corn syrup is bad. I should stop. That's very unusual, but every single day, if you reward interactions, you create a value, you create a currency that tells people that, oh, you're drinking soda again. Okay, did you know this? Did you know that? Did you know the number of calories? And then over time, you can actually inspire people to make that change, and then go back to the bullet before, share it with their friends. What Facebook allows us to do is share success. What about healthcare success? I overcame this disease. I overcame this illness. I lived the way I wanted to live. I fought cancer and won. That's the most powerful social message on the planet. So much so that if you look up on Facebook, Mark Zuckerberg's page, he has the 3 things that he thinks Facebook has changed. One of the bullets, healthcare. Visual. People don't actually like filling out forms. People don't actually like standing in line. People don't actually like waiting for things. But if you put a health risk assessment in the form of a bunch of questions, a long form, and a blank piece of paper at the bottom that says, tell me everything about you, do you really think you're going to get everybody to do it? Or what if you made it fun and visual? What if you made, do you smoke, and had a picture of a cigarette pack and a not-cigarette pack with an X across it, and then you said, if you answer this, I'll give you a coin. And then answer another one, and another one. Next thing you know, you've completed a health risk assessment, and now I go back to the Aetnas of the world, the Uniteds of the world, and say, now based off this risk assessment data, let's actually start to personalize products and benefits to an employer, to a subset of patients. And then the next one is, it has to be secure. We can't have a web experience that's not HIPAA compliant, because I want to be able to ask that tough question about where my son is on the autism spectrum. And I don't want people to know that it's me. I want my personal health information to be mine. It can't be shared on the web, which is why social has to invent healthcare rather than healthcare coming into Facebook. Because people don't want to share with the world their diseases. They want to connect privately, but get the experience of sharing without the fear of being judged. And then the last one goes back to make it personal again, and make it simple. Because the more personal, the more simple, the more fun, the more visual, the more interactive, the more social, and the more secure, the better the health outcomes will be. And I want you guys to think, when you look at the space very closely, there's a couple of showstoppers. Really look at data on aggregate. we as an industry are going to have one shot to really win our consumers' trust. If you go out to the market and you say, we had this great site that got shared on Facebook, or we had data leak, we forgot to do penetration testing. That's going to be a really tough uphill battle. Because if you look at things like the consumer web, if this stuff happens, people are gone. And then the last thing to get to is if we can make this fundamental shift, that 75% that I mentioned to you, that's $2 trillion. I know that our government has had some issues with paying bills, and I think this might help. And I think if you think about how we get back to changing an industry, and what John was saying about the bicycle of the mind and then changing one person at a time, we have the opportunity to do that by being very proactive, by saying, it's here today, social is here to stay, it's not a gimmick. Gaming is not a gimmick, it's a psychology, it's a way of life. It's what we love to do on a day-to-day basis. It's why we like to play poker. That's why we like to brag to our friends. Search has been here for 10 years, and what Google did is they made it now to the point where they will literally predict what you're searching while you're doing it. And then the last one is mobile. We do everything more and more and more and more on our phones. We take iPads with us. We don't even go to our desktops anymore. So now, with those 4 things in mind, let's put health in the hands of the individual. Let's make a change, and let's try to save $2 trillion and impact people's lives and get to a better place. Thank you for your time.